Is anxiety a mental illness? Anxiety is something that everyone experiences from time to time. If you are someone who experiences anxiety, you may be asking yourself if anxiety is a mental illness. Anxiety on its own is not a mental illness. While most people experience anxiety symptoms sometimes, anxiety itself is not a mental illness. However, if your anxiety is significant, you may have an anxiety disorder, which is a type of mental illness. What is a mental illness? Mental illnesses are psychiatric conditions that impact a person's moods, behaviors, and thoughts. They are common. About 1 in 5 people experience mental illnesses, and up to 4% of people experience a severe form of mental illness. What the term mental illness means. Mental illness is defined as a condition that affects your emotions, relationships, behavior, and state of mind. There are some people who experience mental illness on a short-term basis, but for many people, mental illness is a lifetime condition that needs careful attention and effective treatment. Some of the most common mental illnesses include depression, including unipolar depression and bipolar depression. Anxiety disorders. Personality disorders, such as borderline personality disorder and narcissistic personality disorder. Is anxiety a mental illness? The emotion of anxiety itself is not a mental illness. Most people experience anxiety at different times in their lives. You may experience it if you are in danger in some way, or if your loved one is. Anxiety disorders can disrupt your life and make it difficult for you to function. It's estimated that about 30% of adults will experience an anxiety disorder in their lifetime. How is anxiety diagnosed? If you are unsure if you are experiencing simple anxiety or an anxiety disorder, it's important that you receive a proper diagnosis. Diagnoses of mental health disorders are made after you meet with a therapist to discuss symptoms and experiences. Therapists use the Diagnostic and Statistical Manual of Mental Disorders, DSM, to diagnose specific anxiety disorders, based on information they gather from you. Anxiety treatment. Treatment for anxiety disorders usually involves a multifactorial approach, a combination of therapy, medication, and lifestyle changes. Therapy. Your therapist can help you identify situations that trigger your anxiety, and help you come up with techniques to help you work through these feelings. Cognitive behavioral therapy, CBT, which focuses on being more self-aware of the thoughts that contribute to anxiety, is one of the most effective therapies for anxiety. Medication. Many people find that medication can help reduce anxiety symptoms. You should speak to your doctor or psychiatrist for the best medication for you. Lifestyle changes. People with anxiety benefit from changes to their lifestyle. Reducing stress, exercising, and reducing caffeine can also lessen symptoms of anxiety. A word from Verywell. If anxiety is something you are dealing with for the first time, or something you experience on a regular basis, you may be wondering if you have a mental illness.